Yes.
Yes.
But it's not everyone's cup of tea. However, there are requirements for you to complete a pathology residency.
Per ACGME guidelines, every resident has to do at least 30 autopsies. You know, you may learn to love it and do a lot more and go into forensics.
I would say the majority of anatomic pathologists don't want to do autopsy in their day-to-day, and they don't do it.
Once you're out of residency, unless you choose to be in forensics or a medical examiner, you don't have to do an autopsy ever again if you don't want to. The caveat to that is if you're in like a smaller community hospital, you may be the pathologist or, you know, one of just a couple pathologists, so you may be called on to do some autopsies.
During residency, you're going to be trained and become competent in doing autopsy.
And the people that work in the autopsy suite,
they're amazing at what they do.
you're not just going out on your own. And,
Autopsy is one of those things that can like really psych a person out, especially if they're not going into pathology for forensics or for autopsy. And really keep in mind how you're helping the patient's family and the patient and the broader community, and so you can kind of think about the impact of the work that you're doing as like a helpful thing to think about if you're not looking forward to it. And also just remember, everything is transient, and if it's not for you, it's not forever.